Step 1. Loading the cartridge into the pen. Hold pen instructor with one hand, remove pen cap with other hand. Separate the cartridge holder from pen body. Put the Lomovian cartridge in cartridge holder. Bring the pen body and cartridge holder together. Push both and screw together. Step 2. Preparing the pen. Wash your hand properly before preparing your pen. Check Lomovian medicine in cartridge. It should be clear and colorless without any particles. Wipe the rubber seal of cartridge with alcohol swab. Step 3. Attaching the needle. Use a new needle for each injection every time. Remove the paper tap from outer needle seal. Attach the cap needle to the end of pen by pushing it all. Rotate clockwise. Remove outer needle shield by holding pen. Don't dispose the needle shield. Remove the inner shield and throw it away. Step 4. Priming the pen. Turn the dose dialer clockwise into the to appear in dose window. Hold your pen with needle pointing up. Hold the thumb button firmly and calculate to 5. Repeat dialing 2 units and pressing the dose button till drug comes out of the pen needle. Step 5. Setting the dose. Rotate the dose dialer clockwise to set the required dose. Don't press the dose button to readjust the dose again. Dial back to set required dose, if dialed higher dose. Step 6. Injecting the dose. Follow doctor's instructions and prepare your skin for Lomovian injection. Hold the skin tightly and push the needle straight in skin. With the help of thumb, inject Lomovian injection. Hold the thumb for count 5 to inject Lomovian completely in skin. 0 number in window indicate dose is completed. Step 7. After an injection. Replace the outer needle shield carefully. Remove the cap needle by rotating anti-clockwise. Dump the used needle in disposable container. Replace the cap on the pen. Avoid to store or throw the with needle attached pen. Store Lomovian multi-dose reusable delivery device at 25 degrees Celsius. Dosage 1 mg per body weight or 40 mg per day in antiphospholipid antibodies. And respective pregnancy loss for subcutaneous use.